Imagine a newborn taking its very first breath. The moment is not just symbolic but physiologically transformative. In that instant, the entire circulation of the body shifts and the lungs become the gatekeepers of life. If the lungs fail at this critical juncture, nothing else in the body can compensate. This is why understanding the pulmonary system from its earliest origins is essential. Today, we embark on a journey tracing the lungs from their birth in the embryo, laying the foundation for understanding every pulmonary disease. Let's explore how the story of our lungs begins long before birth, setting the stage for everything that follows. Lungs start forming as early as the fourth week of embryonic life. It all begins with a small outpouching from the foregut known as the respiratory diverticulum or lung bud. This simple structure is the origin of the entire respiratory system. The foregut, interestingly, gives rise to both the esophagus for food and the lungs for air, a crucial concept to remember. If the separation between the trachea and esophagus fails, a condition called tracheoesophageal fistula can occur, which is a critical clinical point. Remember this: foregut equals food and air. This foundational knowledge is not just for exams but for truly understanding how diseases can arise from developmental errors. Lung development is a stage process, each phase critical for future function. First, in the pseudoglandular stage, 5-16 weeks, the lungs resemble glands branching to form terminal bronchioles, but with no alveoli or gas exchange. Babies born now are not viable. Next, the canalicular stage, 16-26 weeks, brings the formation of respiratory bronchioles and alveolar ducts, with type II pneumocytes and surfactant production beginning. Revival becomes possible only at the end of this stage. The saccular stage, 26 weeks to birth, sees primitive alveoli and capillaries forming close contact, improving gas exchange. Preterm infants may survive here with support. Finally, the alveolar stage, birth to 8 years, involves ongoing alveoli formation, explaining why pediatric lungs are especially vulnerable. Even before birth, the fetus is preparing its lungs for life. Although the fetus doesn't breathe air, it aspirates amniotic fluid, which stimulates lung growth and strengthens respiratory muscles. If there's too little amniotic fluid, a condition called oligohydramnios, lung development is stunted, leading to pulmonary hypoplasia. This is a key clinical connection, as seen in Potter sequence, where fetal kidney problems cause oligohydramnios, resulting in underdeveloped lungs, a flat face, and limb deformities. The chain reaction here is vital. Oligohydramnios leads to pulmonary hypoplasia, which can often be fatal. Understanding these links helps explain why early development is so crucial for lifelong lung health. Surfactant is the game changer in lung development. Alveoli naturally want to collapse due to surface tension, but surfactant produced by type II pneumocytes reduces this tension and prevents atelectasis. The physics is simple. Smaller alveoli are more prone to collapse, but surfactant keeps them open. Premature babies often lack enough surfactant, leading to neonatal respiratory distress syndrome (NRDS), where alveoli collapse, causing hypoxemia and poor oxygen response. Risk factors include prematurity, maternal diabetes, and cesarean delivery. Treatments focus on antenatal betamethasone and giving exogenous surfactant. Remember, NRDS is due to no surfactant, pulmonary hypoplasia from oligohydramnios, and bronchogenic cysts from abnormal foregut budding. Wrap up, let's quickly recap the journey of lung development. The lungs begin forming at just 4 weeks of embryonic life, with survival outside the womb possible only after the canalicular stage when surfactant production starts. Maturation continues with surfactant ensuring alveoli stay open, and lung growth doesn't stop at birth. Alveoli keep forming until about 8 years old. This ongoing development explains why pediatric lungs are more vulnerable and why early life events can have lasting effects. Understanding these stages not only prepares you for exams but also builds a deep conceptual mastery of pulmonary health and disease.